for joining this episode, another session on COVID. I'm Vino and I have Katie with me, and I have the privilege of having Dr. Ayesha Rashid with me. She's an infectious disease physician. We have worked together on research projects. I'll let her do a little bit of introduction as well. But thank you so much for coming on and just having a quick chat with us, Dr. Rashid. Would you like to just share a little bit about yourself?
Absolutely. Thank you, Vinu, for giving me the opportunity. My name is Ayesha Rashid. I'm an infectious disease physician with St. Paul Infectious Disease Associates, and I cover hospitals with Alina as well as mHealth Fairview, and I'm happy to be here.
Can you tell us a little bit about the work that you do with the state level as well, the information that you are privy to, because I think that'll give a little bit of context to the audience as well.
So, since the pandemic started, all of us kind of had greatness thrust upon us, I should say. There had to be a lot of there was a lot of work that needed to be done in a very short time frame, which required a lot of collaboration across different hospitals within the state, and also at the national level. So we tried to do as best as we could, because there's obviously the first priority is to take care of the patients, but there are weekly calls by the Minnesota Department of Health for ID physicians, where as a state, ID physicians bring up various issues and challenges that they're facing, what has worked and what hasn't. And so we regularly try to attend those meetings. I also have a small role to play with the Infectious Disease Society of America, where I serve as a medical advisor to their clinician on call service, where they partner with the CDC to handle challenging questions that are related to patient care, that CDC then escalates to the Infectious Disease Society of America ID clinician volunteers. So I kind of have some vague idea of what's happening at the national level, what kind of queries are coming up. You may know that Society of Healthcare Epidemiology of America and the Infectious Disease Society of America hold weekly webinars to bring us up to date with the rapidly changing information regarding COVID-19. So we also participate in those meetings. So I'll try my best to share as much as we know. I am, not, there's nobody who can kind of be current to all the information that's coming out. I'm pretty sure by the time we're done with this interview, something else has been published, but I'll try my best to share as much as I can. So thank you once again for the opportunity.
No, thank you so much, Dr. Rashid. I think one of the biggest queries that I have been getting from community and people around me is the fear for kids, right? We all have kids and we are very concerned about that. And so I think one of the questions is, what are some of these vaccine research and studies that are in the pipeline or that we are doing for kids under 16? Because right now there is nothing publicly available, and everyone's like, okay, is it going to be safe when it comes for kids or what? So if you want to talk a little bit around that, Dr. Rashid.
So right now, as far as I can tell, there are two main clinical trials that are enrolling the pediatric population. So these are children between the ages of 12 and 17. So this is youth. Now, before I get into that, we need to understand the reason behind the stepwise approach when it comes to vaccinations, right? So the immune system varies by age, right? So we try to enroll healthy, adults with less kind of comorbid conditions first, right? Then you expand the trial based on phase 1, phase 2 data to those folks with risk factors, right? Once you have enough safety and efficacy data in that cohort, then you go to the next step, which is in this situation, both Moderna and Pfizer are enrolling what they call the youth. So that age group falls between 12 and 17 years of age. The Pfizer trial is the one that I think is projected to start enrolling, and the Moderna trial is I think their estimated completion date is around June 30th. Um, Once we have safety data in that subset, one could then move to the next group, which is less than 12 years of age. And then it goes in stepwise fashion. I'm not a vaccinologist, so I'll be very clear about that. But that's the understanding. That's been the discussion. Now, some of the data for that youth group in folks that are already enrolled, the interim data may be available, but I'm not sure about the timeline. But hopefully, in the next few months, we would have some more information about that youth group. There are a lot of, if you Google, there are a lot of initiatives where they are encouraging that age group to enroll. I think they're looking at 3,000 participants in one of those trials. So that is the issue with vaccine. The same goes with pregnant women. I know Pfizer is doing a placebo-controlled trial, right? Or looking to start a placebo-controlled trial in pregnant women, and it's the same issue that you just cannot generalize the data
Right.
from that adult cohort to the pediatric population.
So I think one of the fears that everyone has is, how would this affect kids? So from your standpoint of view, as a physician, how do you find it safe for kids? How would you assure community that this is pretty safe moving to this cohort group?
We need to look at the science. So I, like all of us, we have to wait for the science, for the data to be available. And once in these rigorously conducted trials, there is safety data available, one would be reassured to expand it to the public. And then based on the available science and evidence, one could decide. So I think we just have to look for that data and the evidence once it becomes available, and go through the rigorous scientific process and peer review that has been happening so far in the other vaccines that have received the emergency use authorization. So I would say that rather than having you know, biased opinions, uh, one should trust the available data, which will be publicly available, in which these questions would be answered. Now, as you know, for adults, even after the emergency use authorization, these are not FDA approved vaccines, but there is the V-Safe program, right? Where this is real world data now, right? So now patients or participants, I should say, or general healthcare workers that have received the vaccine go and enter data. So there's a lot of encouragement from CDC that one should participate in those kinds of registries, so that we would be able to capture any possible adverse effects or complications that were perhaps not picked in the trial. So I think the same process would be followed once we expand it to the to the younger population.
Mhm.
So
That-
my advice to my clients always is the same, that you know, you would have the availability. Use trusted resources is another thing to keep in mind. It sometimes becomes very challenging to differentiate misinformation from trusted sources, right? So once you know that these are the sources where uh, a scientific process has been followed, it becomes a little easier to navigate through that information. And then ask your pediatrician.
Thank you so much. Katie, you had a few questions.
Yes, you've addressed the fact that it's going to take a while for the data to come out. What can you offer with regard to substantiated information with regard to children and their capacity to be spreading of COVID while not necessarily being symptomatic or experiencing much themselves?
So again, this is also an area where more information is coming out. It is true that the younger population, especially children, school going children, may not be as symptomatic or have very mild symptoms when they are infected with SARS-CoV-2. This does not mean that children cannot get sick. Um, so when they look at the viral transmission in the pediatric population, that does happen. So if you're in close contact with other kids, for instance, on a play date, right, it is possible that the kid may not have the severe symptoms that an adult might, right? They may have very mild headache or fatigue that they may not verbalize, right? And then become a reservoir for transmission. So that's where that information is coming from. But it does not mean that the kids are immune to
Mhm.
the infection. There have been cases where kids, especially those with underlying conditions or risk factors, can develop symptomatic disease.
Mhm.
So, to answer your question, yes, it's possible that the kids have very mild symptoms or asymptomatic and yet harbor the virus. And if they're in close contact with somebody else, they are able to transmit.
As more and more organizations are opening up and more children will be gathered with adults as well, whether they be schools or churches or recreation facilities, what would you say with regard to the steps to take to maintain safety through that further contact happening?
Yeah, that's a very good question. So it is supposed to be a multi-pronged approach, right? So whenever we're talking about infection prevention, especially when it comes to COVID and the risk of transmission from young to adult, it has to be a multi-pronged approach. What do I mean by that? So the first is we start with the very basics, wash your hands. With kids, it's very important to make sure that, especially the little ones, that they're washing their hands under supervision, right? So, the whole 20 seconds, and if they're using a hand sanitizer, make sure everything's, all the surfaces are covered. So that's the key. Avoid very close contact, as I just said, to somebody who may be harboring infection, or in close play dates with larger groups, be very careful that if they're able to limit that interaction or be outside, that would be key. In schools, I know there are a lot of measures that are being put in place for safe, physical distancing and making sure that if they're sick or symptomatic, right, then they stay home until they're recovered. And then the other big one is the mask. If it's really hard for the very young ones, right? Those who are less than 2. There was some talk about maybe having a face shield for the little ones, but I think that's also hard to keep on. But those who can, especially our middle schoolers and high schoolers, right? So if they can, we highly encourage that you wear a mask. So washing hands, physical distancing, avoid close contact, wearing a mask. And then the other one would be cleaning and disinfecting, right? So making sure that the frequently touched surfaces at home or wherever you are regularly disinfected and do not become reservoirs for transmission of infection. The other question that's come up, and I know people are not going to like my response, is travel, right? So with the spring break coming up, so I think as infectious disease physicians, we're very paranoid about travel. So our recommendation is that if you could limit travel, it would help. At least for the next, a couple of months or so, till we get a better handle on this pandemic. I was reading that this is the first week or so that we have seen an actual decline, a significant decline in infection in the US, right? And it may be the masking, it may be the distancing. Some people are hunkering down till they can get the vaccine, but you can see the impact. So applies to the kids too, right? It's really hard for them to stay inside for a prolonged period of time, but I would really encourage families, if they could limit travel, um, as much as they can till we get this under better control. That's something to just add there.
No,
And
thank
once
thank
the vaccine, yeah, once the vaccine becomes available and you have data, then obviously we would go for it.
No, thank you. I think this was very, very informative and very helpful to hear all of those different parts, because I think, the more the people hear about it, the more it's reiterated. And I think you touched on something really good. Like it's that risk, right? How do we control that risk? How do we manage that? So appreciate your time, Dr. Rashid. Thank you for all your insights, and hopefully this was definitely helpful. And if you have any questions or comments, please put it down, and we will try to respond. Again, thank you for your time. And thank you so much, Dr. Rashid.
You're welcome. Stay safe and stay strong. Bye-bye.
Thank you.
Bye.
Bye.